Hello, welcome to Head Series with Nurse Faustina. In today's series, we'll be talking about fontanelles and their importance, and we'll also look at if there are any medical condition or medical intervention that they require. All right, first of all, fontanelle, before I proceed, I want to beg mothers, please, spare my little cuties the stress of taking those medication, those mixtures, herbal mixtures in the name of treating intimacy. Fontanelles are called intimacy in Igbo language. I don't know other names that it bears in other dialects. Okay, fontanelles, they are very essential. They are important in the development of a baby. Okay, it is usually called soft spots. These fontanelles, they are spaces between the bone of the baby's skull. The essence is to allow flexibility during delivery, that is to allow the baby's head to pass through the birth canal seamlessly. And another benefit is that it gives room for the brain of the baby to develop, more especially in the first year of age or the first year of birth. Okay? And there are two primary fontanelles that we have. We have the frontal fontanelle, we have the posterior fontanelle. And these fontanelles close up a different time range. Okay, the anterior fontanelle closes later while the posterior fontanelle closes earlier. The posterior fontanelle closes within 6 weeks to 3 months depending. All right, while the anterior fontanelle, which is the one we usually see that does tinkum tinkum tinkum, something like that. Okay, it closes around 18 months going to 2 years. Okay, and the anterior fontanelle has this diamond shape. Okay, diamond shape, while the posterior one has triangular. All right, that notwithstanding, let's look at what you should note when it comes to fontanelles. Fontanelles, in as much as they are essential part of baby's development, it also indicates some few things regarding the well-being of the baby. Like when the fontanelle is sunken, it indicates that the child is dehydrated. And if the baby is exclusively breastfed while having that sunken fontanelle, it means that the baby is not getting enough breast milk. Yeah. And if the baby is going through misfeeding, it means that the baby is not getting enough fluid, enough water. And in a case whereby the baby is stooling, it indicates that excessive water or excessive fluid is going out of the baby's body and needs replacement. Okay, so while you notice a sunken fontanelle, it indicates that dehydration is going on in the body of the child. Another thing you should look out for is if the fontanelle is bulging. It means that there is too much pressure in the brain, and in this case, it needs medical intervention. It needs the observation of a doctor. Okay, don't stay at home and presume that everything is okay. All right, and again, there are no medical intervention whatsoever so long as these two signs and symptoms I mentioned earlier are not present. These fontanelles close naturally. And if you notice again that the fontanelle didn't close at the age of 2, please, to the hospital. Go for pediatrician review, okay? So the pediatrician will look at the child and know what next to do. And not go about going to houses or going for consultation on how to treat intimacy because you heard that intimacy causes so and so without practical evidence. Please don't give these children the herbal mixtures. Herbal mixture doesn't close fontanelle. Please, it closes on its own naturally, more especially when there is no complication or where there is no issues. Okay, so intimacy is not a disease condition. Fontanelles are not disease condition. So do well to know where you receive advice concerning your child. Don't play truth or dare with your child's health. All right. See you in my next